timing of surgery is always a challenge. I think principle number one should be we should reserve surgery until we have failed other conservative management measures. So, for example, if someone comes into my office and has hip arthritis and they come in expecting a surgery in their 40s, that's usually not what I talk to them about the first visit. I talk to them about taking different medications. So sometimes we talk about taking Tylenol. Often we talk about taking non-steroidal anti-inflammatory. So that's ibuprofen, Aleve, Celebrex. There's literally hundreds of those out there that we could discuss taking and see where they're at with that. Sometimes we talk simply about optimizing those. There are a lot of things we can optimize in a patient's life. So one is their weight. You know, weight has not only a mechanical, but there's also some studies that show there are some biochemical issues that may lead to further or accelerated cartilage damage. And so we talk to patients about their weight. How do we manage our weight? Can we get our weight down? We know that if we get your weight down, we're decreasing what we call joint reaction stresses, so they theoretically should have less pain. We talk about appropriate exercises. So instead of high impact CrossFit, cross-training things, if patients have arthritis of their hip and knee, we need to look at low impact exercises. So yoga, Tai Chi, swimming, bicycle, those sorts of activities. We can talk about things like a cane in certain cases. An assisted device can be very dramatic in decreasing the pain of an arthritic joint. We will sometimes talk about injections into the knee. Steroid injections are quite common. They seem to be very beneficial for the first month. Some of the studies would show that there's not a lot of benefit greater than a month. However, when you take care of a large population of people, you will see patients that get a steroid shot that get 4, 5, 6, 7 months of relief from sometimes, and that's also very favorable in a way to manage them as long as it remains appropriate. And then ultimately, if none of those things work, and the patient says, I have pain that interferes with my ability to be a dad, be a husband, be an employee, I can't live with this pain, then I think then it's the time to start discussing having your hip or your knee replaced.